Okay, so I think we're going to get started with the webinar for today. I want to thank everyone for attending to the webinar for today. It's Meaningful Use Made Easy, Step-by-Step Approach to Stage 1 Compliance, as well as 2013 changes. So this will be really informational for those who have already done 2012 attestation and are now doing the full year for 2013. To introduce myself, my name is Denise Ramos. We are going to have a question and answer section at the very end of the webinar. So I'm going to start off with exactly what is meaningful use. Meaningful use is best defined as demonstrating the use of a certified EHR in ways that can be measured as being used in a meaningful way. So this includes using ePrescribe. So for those who have questions, do I need ePrescribe? You do need ePrescribe. Also using the EHR technology for electronic exchange of health information. This is something that's going to be done through a CCD, mainly with a CCD. And then also using EHR technology to submit clinical quality and other measures. Doctor must comply with certain objectives in 3 stages. We are currently in stage 1, and they must comply with 20 objectives. 15 are coming from a course set, so these 15 course set you must attest to, plus 5 that they must select from a menu set of 10 objectives. So you have a little bit more of leeway as far as your 10 objectives, the last 10 objectives. So there are the 25 measures. 9 require yes or no questions. So at the end of your reporting period, you're going to go in and they're going to ask you yes or no questions. If you've done a certain task or if you've enabled a certain functionality, you'll say yes or no and then move on to the next question. 16 will require a numerator and a denominator. These numbers can be found in a report. We have about 2 of them in our system. And then in addition, you must attest to 6 clinical quality measures. Now it has changed a little differently for 2013. They have pushed more PQRS, and that will kind of talk a little bit later on. In the reporting period, if it's your first time attesting, your first year, it's a 90-day reporting period. After your first year, it's the entire year. So for those who have already attested in 2012, they've done a 90-day reporting period. 2013, they're doing these 20 objectives for the entire year. Now the incentive is 75% of Medicare Part B. After 2015, there are penalties that will apply. So you have 1 to 3% from 2015 to 2017. Then you have 3 to 5%. 2018-2019. As far as for Medicare, there are no penalties. Incentive payments are a fixed amount each year and do remain constant as long as you meet all eligibility requirements for program participation. Now, who is eligible and how do you register? For Medicare, it's doctors of optometry. For Medicaid, it's physicians, primarily doctors of medicine. But there are 5 states that now offer Medicaid EHR incentives to doctors of optometry. So those 5 states are Alabama, Illinois, Kentucky, Ohio, and South Carolina. I do have this link here, and this will actually be shown in our support central for the Medicare and Medicaid registration and attestation system. So for those who have not already registered for the incentive, you would just go on this link here. I'm just going to open up the link. And then there you'll be able to register. They'll ask you questions, and this is per doctor. It is not per practice. So they'll ask you for your NPI number and your personal information in order for you to register. So the website it's taking me to, it's cms.gov. And if you ever just enter cms.gov, you can always, in the search bar, you can always type in meaningful use or EHR incentive. That's going to take a while. I'm just going to move on a little bit. So what you do need is an individual NPI number and a user account with a national plan and provider, immunization system, web user account, and you must also enroll in PICOS. This is something that you do want to get a head start on as far as registering, just in case you have any problems as far as registering with PICOs, or if they don't have a certain information. You want to try and get that taken care of as soon as possible. Now, as far as the new changes for 2013, this will apply for for those who have already attested. So for the first one, computerized provider order entry, or CPOE, this is a core objective. There is now an alternate measure. So based on the total number of medication orders created during the EHR reporting period, a doctor eligible hospital or CAH may select either measure for this objective. So there are more than 30% of medication orders created by the doctor or authorized providers of the eligible hospitals or CAH inpatient or emergency department during the EHR reporting period are recorded using CPOE. For number 2, electronic prescribing, this is core objective number 1. There is an additional exclusion. So any doctors who does not have a pharmacy within the organization, and there are no pharmacies that accept electronic prescriptions within 10 miles of the doctor's practice location at the start of his or her EHR reporting period. Then number 3, record and chart changes in vital signs. This new measure amends that age limit to recording blood pressure for patients ages 3 and over and height and weight for patients of all ages. There is also no exclusions. So any doctor or any EPs who sees no patients 3 years or older is excluded from recording blood pressure. They believe that all 3 vital signs of height, weight, and blood pressure have no relevance to their scope of practice and is excluded from recording them. So that measurement or that exclusion had already applied in the previous years. And then any doctor or any EPs who believes that height and weight are relevant to their scope of practice, but blood pressure is not, is excluded from recording blood pressure, or believes that blood pressure is relevant to their scope of practice, but height and weight are not, is excluded from recording height and weight. For those who have already reported in 2012, or also already reported in 2013, they did notice, and I had a couple customers notice, that they actually took away 2 of their core objectives. So core objective number 14 is now obsolete. That one was electronic exchange of key clinical information. So beginning in 2013, the objective for electronic exchange of key clinical information will no longer be required for stage 1 for EPs, eligible hospitals, and CAHs. And then also reporting clinical quality measures. It is now a separate objective for reporting ambulatory or hospital clinical quality measures as part of meaningful use. So EPs, eligible hospitals, and CAHs will still be required to report on clinical quality measures in order to achieve meaningful use. CMS is removing the standalone objective that requires providers to attest that they plan to report on clinical quality measures because it is redundant. So now we're going to get started with our 15 core. Well, I'll say 15, but actually there's now only 14. So the first one is CPOE for medication orders. I'm going to go back and forth between the slides and My Vision Express just so you can see exactly what I'm doing inside of My Vision Express. So the objective is using computerized provider order entry for medication orders directly entered by any licensed healthcare professional who can enter orders into a medical record per state, local, and professional guidelines. Now the measurement is more than 30% of all unique patients with at least 1 medication in their medication list seen by the EP have at least 1 medication order entered using CPOE. Now there is an exclusion that does apply for both the 90-day reporting period and the yearly reporting period. So if you are a doctor who writes less than 100 prescriptions during this reporting period, you can go ahead and take the exclusion. Now, how do you do this in My Vision Express? Anytime that you go into My Vision Express and I have a patient, or I have myself already pulled up here, when you go into the medications tab of the examination, anytime that you are entering a medication, whether it's using our RX pad or if it's done through ePrescribe, then this will count towards this objective. This is an objective that is only looking at prescriptions that you are prescribing. It is not looking at outside prescriptions. So this is something that's always going to be 100% so long that as you are writing this prescription within MyVision Express. If you're writing it in a medication pad, it's hard to track it in our system, but it's something that you want to avoid. You want to try and enter all these medications within MyVision Express. So the next one is drug interaction checks. This one is actually a yes or no question. This is one of the reasons why you need ePrescribe. So within MyVision Express, you want to enable this functionality for the entire reporting period of implementing a drug-drug and drug allergy interaction check. This is done through NewCrop, or this is done through an ePrescribe. Now, I've had questions of whether or not using another vendor will still count, and it does. As long as you're using an ePrescribe program, then that's fine. Now, the benefit in using ours or going through us with NewCrop is the fact that we can keep track of how many patients you are using or you're prescribing medications through ePrescribe. So the reporting is a lot easier and it's done through us. Whereas if you chose a different vendor, you would have to manually keep track of all the patients that you have done ePrescribe with. So now we have core objective number 3, maintain a problem list. So the objective is to maintain an up-to-date problem list of current and active diagnosis, and the measurement is more than 80% of all unique patients seen by the EP have at least one entry or an indication that no problems are known for the patient recorded as structured data. So going into MyVision Express, I have my problem list in my examination. So what they're looking for is that you are either adding at least one problem, or if they have no known problems, that you check off the no known problem checkbox. As you see, it is highlighted in this seafoam green color to indicate that it is related to meaningful use. The next objective is ePrescribing. So the objective is to generate and transmit permissible prescriptions electronically. The measurement is more than 40% of all permissible prescriptions written by the EP are transmitted electronically using certified EHR technology. The exclusion of fewer than 100 prescriptions during the reporting period does apply. So once again, if you have about 90 prescriptions that you wrote in this reporting period, then this exclusion does apply. But if you surpass that 100 prescription, then you would need to keep in mind that you need 40% of those prescriptions entered through ePrescribe. So once again, going back into MyVision Express, if I go into my medications tab, and if I am using ePrescribe, it's actually looking at a source within MyVision Express. So this is how it recognizes it. So I'm just going to go ahead and add a prescription to show you where it's looking. So I'm just going to add any prescription here, and if I scroll all the way to the right, this is what our software is looking at, is the source. If it's something that's done through MyVision Express, through that RX pad, then it'll be labeled as MVE. But if it was something that was, written through ePrescribe, then the source will change to ERX. The next objective is active medication list. So this is very similar to the problem list. The objective is maintaining an active medication list. The measurement is more than 80% of all unique patients seen by the EP that have at least one entry or an indication that the patient is not currently prescribed any medication recorded as structured data. Going back into MyVision Express, it is looking at an active medication list. So this is looking at medications that you have written as well as outside medications. Once again, if there are no known medications or no known reported medications, you do have the box here. So if I delete this medication, it's highlighted as well to indicate that it's related to meaningful use. Core objective number 6, medication allergy list. The objective is to maintain an active medication allergy list. The measurement is more than 80% of all unique patients seen by the EP that have at least one entry or an indication that the patient has no known medication allergies recorded as structured data. So the next tab, or the tab before medications, you do have your allergies. It is highlighted, so if there are no known allergies or no known medication allergies, you would just check this off. Otherwise, if they do have a drug allergy, you would just click on Add. You'll see here my allergy type. Now this is really important to remember. I've had tons of questions of it not counting towards the report, and it's because the allergy type is labeled as Other. So the only way that our software will recognize this is if it's under a drug allergy. On the bottom, you would just type in the allergy and the reaction. And then you do have a status of active here. Number 7 is record demographics. So the objective is to record all the following demographics: preferred language, gender, race, ethnicity, and date of birth. This must be done with more than 50% of all unique patients seen by the EP that have demographics recorded as structured data. So I'm actually going to go into a patient profile, and once again you'll see that in the patient profile, I'm just going to delete a couple here. Anything that relates to meaningful use is highlighted in this seafoam green color. So it is looking at everything. So you must have ethnicity, you must have race, you must have language, date of birth. You'll also notice that the email and smoking status is highlighted as well. The reason why we have email highlighted is because it is related to meaningful use, but you do not have to enter the email address. The main concern is your sex, your ethnicity, race, and language, and date of birth. We also have smoking status here that's highlighted because this is actually going to relate to another objective, which we'll cover in just a moment. One of the most common questions I get is, do I have to document both ethnicity and race? You do. Another question that I always get is, if they are Hispanic or Latino, what do I write as far as race? My best suggestion is to use your best judgment. I know that they have changed it where for stage 2 you will be able to enter that the patient declined or unknown. Number 8 is record vital signs. So the objective is to record and chart changes in the following vital signs: height, weight, and blood pressure, and to calculate and display body mass index, plot and display growth charts for children 2 to 20 years, including BMI. The measurement is for more than 50% of all unique patients aged 2 and over seen by the EP. Height, weight, and blood pressure are recorded as structured data. Now there are the exclusions, so I discussed it a little before. So any doctor that feels that that blood pressure and height and weight doesn't really apply to optometry, they can go ahead and take that exclusion based on, in the past, I've had customers who do and don't. It's half and half, really. I think actually more so they lean to taking the exclusion. So in order to do that within My Vision Express, you're going to go to your Vital Signs tab, and when you click on Add, you'll see that all the required fields are highlighted. You do have the growth chart. Now, as far as meaningful use, you don't have to do anything with the growth chart. We do have the capability of having this growth chart. So this is satisfactory enough. They're not going to ask for this growth chart. You do already have it enabled. The next objective is record smoking status. So the objective is to record smoking status for patients 13 years and older, and the measurement is more than 50% of all unique patients 13 years and older seen by the EP have smoking status recorded as structured data. The exclusion is any EPs who sees no patients 13 years and older. Going back into My Vision Express, there's 2 places that you can enter this information. As we saw before, in the patient profile, it is highlighted for you to remind you that it is related to meaningful use, so you can document your smoking status. You do also have it in the Past Family Social History tab. So once again here, it does reflect When you enter it in the patient profile, that information does transfer over to past family social history. But if for any reason you do not have it entered, you do have another chance to enter this information here. Now, number 10 is clinical quality measures. The objective is to report ambulatory clinical quality measures to CMS. The measurement is to successfully report to CMS ambulatory clinical quality measures selected by CMS in the manner specified by CMS. Now, they did take this objective away. I haven't had the chance to see exactly how it looks like when you attest. So I do apologize. The moment I have more information, I'll be more than happy to share this with you all. But to kind of still briefly go over clinical quality measures, I'm going to go into my Vision Express and I'm going to go into a report. So I'm going to go to File, Reports, Patients and Clinical Quality Measures. Now, clinical quality measures branches off into 6 additional measurements. You have your core and you have alternates. You have 3 cores that you would attest to. So you have adult weight screening and follow-up, you have hypertension blood pressure measurement, and you have preventative care and screening measure pair tobacco use, assessment, and tobacco cessation intervention. There's about 4 that apply to optometry as far as your alternate clinical quality measures. So you would choose 3 additional alternative clinical quality measures. The ones that do apply are primary open-angle glaucoma, diabetic retinopathy. You have 2 of them actually for diabetic retinopathy, and then you have diabetes eye exam. Now, I do want to stress that these measurements have no percentages tied to them. So I've had customers who've actually attested 0 out of 0 for some of these measurements because they might not apply to optometry or to their practice, and that's absolutely okay. You can attest 0 out of 0, and you can still move on with the attestation and still successfully attest. Now, what they're looking for is special patients. So for the example of hypertension blood pressure measurement, it is specifically looking at patients who are 18 years and older with a diagnosis of hypertension and who have been seen for at least 2 office visits with their blood pressures recorded. Another example is preventative care and screening pair. So it's not only looking to see if the patient is a tobacco user, but it's also looking to see for tobacco cessation intervention. In the exam, this can be done in past family social history. So you do have your smoking status here, so if they were a smoker, and then you provide them with tobacco cessation. They don't specify exactly how do you provide this information, but as long as you've done it and you checked it off in the tobacco cessation checkbox, then this will actually count towards the report. And then you have other measurements like the primary open-angle glaucoma. So once again, it is looking at that specific diagnosis, and it's also looking to see if the patient has been seen twice within the reporting period, whether it's the 90-day or the year. And then you have diabetic retinopathy. Now these last 3, diabetic retinopathy and diabetes, it's looking for a specific diagnosis. So it must be diabetic retinopathy, and it is looking to see if the patient was dilated. Same thing applies with diabetes eye exam. It's looking for patients who have a diagnosis of diabetes that contains the word diabetes or diabetic in the diagnosis, and it is also looking to see if the patient was dilated. So in order to view that or know how to do that within My Vision Express, in our internal tab, you do have the dilation box here. So as soon as you do this, and the patient does have that diagnosis of either diabetic retinopathy or anything that contains the word diabetes or diabetic, it will count towards your reports. Now, for those who have already attested before, you'll notice that, or you've noticed that they did ask if you were participating in PQRS. So this is Physician Quality Reporting System. I'm not going to go too much into this, but I do highly recommend for those who are not aware of this to research, because you can be penalized in 2015 depending on what you've done this year. So beginning in 2012 and continuing in 2013, there are 2 reporting methods available for reporting the stage 1 measures. First one is through the attestation, so saying that you are going to do PQRS or you are going to do clinical quality measures. And then number 2 would be the e-reporting pilots. So this is the Physician Quality Reporting System EHR Incentive Program pilot for EPs, and also the e-reporting pilot for eligible hospitals and CHs. Physicians who qualify may earn a bonus payment on all allowable Medicare charges. So in 2013, it's 0.5%, and 2014, same thing, 0.5%. As I mentioned before, a penalty of 1.5% for not doing PQRS begins in 2015. A penalty in 2015 will apply depending on your 2013 performance. Now we'll move on to core objective number 11, clinical decision support rules. This is another yes or no question. In order to do, or the objective is to implement at least one clinical decision support rule relevant to specialty or high clinical priority, along with the ability to track compliance with that rule. The measure is to implement one clinical decision support rule. So the way that you can do this is if you go to File, Setup, Exam, and Alerts. And then I have a couple examples here, but I'm just going to go ahead and delete them and start over. So what you're going to do, I'm going to go ahead and add one, and my description, I'm going to say glaucoma. The message that I want to appear is check IOP, and I'm actually going to do an age range here of anyone over 40 years old. You can also do an ethnicity and race. So I'm going to say non-Hispanic, and I'm going to say Black or African American. So I need something to trigger this measure, or to trigger this message. So I'm going to go into details, and I'm actually going to add a diagnosis. Now you do have a section here for problems or even medications or laboratory test results. These two will apply more for optometry. So for the problem, I'm just going to go ahead and add glaucoma suspect. This is all that you need to do in order to comply with this measurement. Now what this will do is if I have a patient who is over the age of 40, their ethnicity is non-Hispanic or Latino, and their race is Black or African American, and if I enter that diagnosis in their problem list, so going into here, it's not going to apply with me, but going into my health tab, if I enter in my problem list 365.00, that message, check IOP, will appear. That's all you need to do. Now the next measurement is electronic copy of health information. The objective is to provide patients with an electronic copy of their health information, including diagnostic test results, problem list, medication allergies, upon request. Now the main thing to remember is upon request, if the patient requests this information. The measure is more than 50% of all patients who request the electronic copy of their health information are provided with it within 3 business days. There is an exclusion, so any EP that has no request from patients or their agents for an electronic copy of patient health information during the EHR reporting period. A nice chunk of our customers have taken that exclusion. The reason why is because this information is referring to a CCD. So going into My Vision Express, we have our HL7 CCD CCR tab. For those who don't know what this is, a CCD is a continuative care document. They also call it a continuative care record. What is contained in this document is anything that you have entered in the problem list, allergies, medication, or laboratory test results. The chances of a patient, and the reason why they take the exclusion, is because the chances of a patient actually knowing what a CCD is very slim. If a patient ever were to ask for their information or for a copy of their exam, it would apply more for an exam summary, where it would contain their visual acuity, their refractions, more information like that. The CCD, and I'll actually show you what a CCD looks like. I don't really have any information here, but this is what the document looks like. Had I entered anything in the problem, allergy, medication list, it would appear here. But if you do ever have a patient request this information, in order for you to achieve this objective, you would just click on Generate CCD. This is actually going to compile and create the document for you, and it's going to be shown like in a line like this. Then what you're going to do, you're going to click on Upload. What this is going to do, it's going to send it to something called Microsoft Health Vault. This is a free service for both you and the patients, and it allows them to view this information. Now, when I click on Upload, what it's going to do, and I'm not sure if I have it signed up here on my database, but what it's going to do, it's going to give you, and I'm not, but it's going to give you a PIN number. Also a link to invite the patient to sign up for Health Vault. So you'll just provide the patient with this PIN number and you're going to email them this link. This is why we highlight that section in the patient profile for their email address. This is the only way for them to register and to have access for this, to this information. So they do need to give you their email address. Now, number 13, clinical summaries. This is what they're probably looking for. So if they ever do request this information or a copy of their exam, a clinical summary would be perfect for them. So you must provide clinical summaries for patients for each office visit. So office visit, anytime they're sitting in that chair and they come in for a visit, that is what is considered an office visit. The measurement is clinical summaries provided to patients for more than 50% of all office visits within 3 business days. Key thing here is more than 50% and also 3 business days. My recommendation is I would try and do it the same day. That way you don't have a chance of forgetting to print out the clinical summaries. This is something that last year it got a lot of people because either they weren't printing out the clinical summaries or they just barely missed that 50%. So just please keep in mind more than 50%. If you can try and do it for all your patients, try and do it for all your patients. That way you can guarantee that you are going to meet this measurement. Now there is an exclusion, but it won't apply, unfortunately, any EP who has no office visits during the EHR reporting period. So in order to achieve this, you can do it one of 2 ways. Within My Vision Express, you can go back to the CCD, and this will actually count towards the measurement, and you can click on View, and you can actually print the CCD and hand it to the patient. That's one way that you can achieve this objective. Another way is going through our letters module. So on the very top here, you'll go to our letters, and what you're going to do, you're going to print out a letter that says exam summary. Now we do have a standard letter here for exam summaries. Now when you're printing out a letter for exam summaries, in order to achieve this objective, it must say exam summary in the letter. If it says anything other than exam summary, our software will not recognize this. I cannot stress that enough. It must say exam summary in it. We do have a standard letter. There's a 1-page letter that we have for it. If you guys do request it or do wish for it, you can contact our support department. They do have it available and they can always send it to you, or you can contact myself and then I can always help you out with that. But you can go ahead and print this letter out. You can even email it to the patient if you wished, and it will count towards clinical summaries. So just keep in mind, within 3 business days and more than 50% of your patients. Now the next one I'm not going to go over. It's an objective that's now obsolete, so you no longer need to do this one. So I'll just go ahead and move along to core objective number 15. This is another one that that got a lot of customers. Protect electronic health information. The goal with this objective is to run a risk analysis check, a security risk analysis. So the objective is to protect electronic health information created or maintained by the certified EHR technology through the implementation of appropriate technical capabilities. And the measurement is to conduct a review, a risk analysis check. So there are 2 ways that you can do this. You can contact your local HIT Regional Extension Center. I believe the website is actually regionalextensioncenter.com. You're going to find your states. And I know that some of them do charge for the risk analysis. I know other states, they're absolutely free. I believe California was free. Also keep in mind, for the Regional Extension Center, there are some states that they are not going to have it available for optometrists, or they only do it for Medicaid. So this is something that if you know you're going to do the attestation and you know you're going to do meaningful use, I would search as soon as you can your options for this risk analysis. You don't want to wait until the last minute to do it. You really don't. It's stressful for no reason if you do wait last minute. So contact your regional extension center and find out if they are able to do it and how much it is. Or what you can do, we have a document, meaningful use and security document. So I'm going to open this up. So if for any reason you cannot do it through the Regional Extension Center, we have this document that Carlos Ramos was kind enough to make, and it is a meaningful use and security protecting electronic health information in accordance with HIPAA security rule. It is a 39-page document, so it's rather lengthy. It would probably be best to have an IT person to help you out, but what you would just do is you would go through this document if you need to, and you'll just answer yes or no's. If there are some questions that are no, that's fine. As long as you're running the risk analysis, then you are complying with this objective. So that was our 15 core objectives, or rather 14 core objectives. Now we're going to move on to the menu set of objectives. These, out of 10, you only have to attest to 5 of them. Out of those 5, one of them must be a public health objective. Those will be the last 2, and I'll go over those. So there are 5 that I do recommend to attest to, probably the easiest ones, less work for you guys. But we'll start off with drug formulary checks. This is actually one that I do recommend. The objective is to implement drug formulary checks. The measure is that the EP has enabled this functionality and has access to at least one internal or external formulary for the entire EHR reporting period. The exclusion of less than 100 prescription does apply. Now, in order to comply with this objective, all that you would need is ePrescribe. So if you have core objective number 2 already done, then you've already completed this one as well. Enabling the functionality of ePrescribe will satisfy this. Then you can move on to the next one. This is actually going to be a yes or no question. So when you attest, they'll just ask you, have you enabled this functionality? If you have ePrescribe through the entire reporting period, then you can say yes. Number 2 is clinical lab test results. So the objective is to incorporate clinical lab test results into EHR as structured data. There is a measurement of more than 40% of all clinical lab test results ordered by the EP during the EHR reporting period, whose results are either in a positive, negative, or numerical format, are incorporated in certified EHR technology as structured data. The exclusion of an EP who orders no lab tests, whose results are either in a positive, negative, or numeric format during the EHR reporting period. So this exclusion will actually apply to everyone. This is another one that I would go ahead and attest to, because you can take the exclusion and that'll count as your second measurement. Number 3 is patient lists. So the objective is to generate lists of patients by specific conditions to use for quality improvement, reduction of disparities, research, or outreach. The measurement is to generate at least one report listing patients of the EP with a specific condition. Now, in order to do this in My Vision Express, it's rather easy. It's a third one that I do recommend. You're going to go to File, and you're going to go to Letters. And then we're going to go to Extended Search. Now, since I am looking for specific patients, I'm going to go ahead and look for a diagnosis. You can also look for medications, allergies, immunizations, orders, or laboratory test results. So I'm going to use my favorite, glaucoma. I'm going to press OK, and then I'm going to search. Now what this is going to do, it's going to generate a list of patients who have this diagnosis. So all that you would have to do is print, or you can save. Now one thing that you must remember, I'm actually going to show you this window here. Would you like to add this to patient letter history? Say yes, because that way it records it in their patient history, in their interactions, that this list has been generated for them. Now you're going to keep the list of patients here. I would date when this was done, You can even do a screenshot to show the date that this was done, because if you were to be audited, one of the things that they are going to ask for is this list. So you just want to make sure that this list has some type of date on it, or some type of recording in the patient's profile, or in the patient profile, that this has been done. So number 4 is patient reminders. This is another easy one. The objective is to send reminders to patients per patient preference for preventative follow-up care. The measurement is more than 20% of all patients 65 years or older, or 5 years and younger, who were sent an appropriate reminder during the EHR reporting period. This is done through our letters module. And the exclusion is any doctors or any EPs who have no patients 65 years old or older, or 5 years old or younger, with records maintained using certified EHR technology. So for those who do the recalls through our letters module, it is going to be looking at those patients who are 65 years and older, or 5 years and younger. Once you do the letters, it'll count towards this objective. The reason why I do like it is because a lot of people do use our letters module for recalls, and also it's a very small percentage, it's 20%. Now, number 5 is patient electronic access. So this is relating to the CCD. This is not one of my favorites because it is causing more work for you guys. So the objective is providing patients with timely electronic access to their health information, including lab results, problem lists, medication lists, and allergies, within 4 business days of the information being available to the EP. So in other words, once the exam is created. The measurement is at least 10% of all unique patients seen by the EP are provided timely electronic access to the health information, subject to the EP's discretion to withhold certain information. The exclusion that any EP that neither orders or creates lab tests or information that would be contained in the problem list, medication allergy, or any other information is listed during the EHR reporting period. So if this was a menu objective that you wanted to go ahead and achieve, it is only 10% that you would have to do. Now for your patients, and this would apply to all your patients, you'd go into My Vision Express. We're going to go back into the HL7 CCD, and what you're going to do, you're going to generate a CCD for every patient, and you're going to go ahead and upload this information over to Health Vault. So the reason why I don't like it, it's adding more steps for you guys. I think there are other objectives that you can do that doesn't require such steps. So we'll go on to number 6, patient-specific education resources. The objective is using a certified EHR technology to identify patient-specific education resources and provide those resources to the patient if appropriate. The measurement is more than 10% of all unique patients seen by the EP are provided with patient-specific education resources. Now this education can be found in our problem list. You have the education button here. In the medication list, you have the education button here, as well as in our assessment tab. So when you provide the patient with education, this can actually be done either by linking this information into My Vision Express, and you'll see here we have a bunch of test ones, or you can actually provide the education verbally through a website, a pamphlet. As long as you're providing the patient with education, then that's fine. Now once you have provided the patient with education, you do have this education checkbox available here. So whether or not it's done through My Vision Express, or you gave them a pamphlet, or it was a verbal education, just do remember to check this off in order for it to count towards the reports, and in order for it to count for meaningful use. Number 7 is medication reconciliation. The objective is the EP who receives the patient from another setting of care or provider of care, or believes an encounter is relevant, should perform medication reconciliation. The EP performs medication reconciliation for more than 50% of transitions of care in which the patient is transitioned into the care of the EP. An EP who was not the recipient of any transitions of care during the EHR reporting period That is your exclusion. So you actually could do this one. Could be a nice easy one if you were not the recipient of a referral or a transition of care. If you were, though, you would go into My Vision Express, and you're going to go into the patient profile. And you're going to go into the demographics tab. So that's the second tab here. And you would enter their referral information here. So you have the physician, and then you can go ahead and add the physician information in here. So this is how it would count. The fact that you have e-prescribe enabled also does count towards this objective. So the only extra step that you would need to take in order to achieve this objective is to add the referral information, and that would be it. Number 8 is transition of care summary. So this is actually the opposite. So the EP who transitions their patient to another setting of care or provider of care, or refers their patient to another provider of care, should provide summary of care record for each transition of care or referral. The measure is that the EP who transitions or refers their patient to another setting of care or provider of care provides a summary of care record for more than 50% of transition of care and referrals. The exclusion is an EP who neither transfers a patient to another setting or refers a patient to another provider during the EHR reporting period. So if you do not refer a patient out throughout this reporting period, you can go ahead and take that exclusion. But if you do, in My Vision Express, in our assessment tab, you would document the refer to and the reason. This is actually going to be your denominator. Now, you can do one of two things, very similar to the clinical summaries. You could either go back into the Health tab and you can generate a CCD and print it out or upload it, and that will count. Or something that will be a little more relevant would be going into your letters module and printing out a referral form. So on the bottom here, we do have a referral section. Let's see if I do have it. So this referral letter is just an example. This will count. Just like clinical summaries, it must contain the word referral in it. So as long as that letter says referral in the heading here, it'll count towards this objective. Now you have your last two objectives, and these are related to submitting information. So number 9 is immunization registries data submission. This is actually an objective that I would go ahead and attest to because you can exclude yourself from it. The objective is the capability to submit electronic data to immunization registries or immunization information systems, and actual submission according to applicable law and practice. The measurement is performed at least one test of certified EHR technology's capacity to submit electronic data to immunization registries and follow-up submission if the test is successful, unless none of the immunization registries to which the EP submits such information has the capacity to receive the information electronically. The exclusion, and this is why it applies, is an EP who administers no immunizations during the EHR reporting period or where no immunization registry has the capacity to receive the information electronically. Number 10 would be syndromic surveillance data submission. The objective is the capability to submit electronic syndromic surveillance data to public health agencies and actual submission according to applicable law and practice. The measure is perform at least one test of certified EHR technology's capacity to provide electronic syndromic surveillance data to public health agencies and follow-up submission if the test is successful, unless none of the public health agencies to which an EP submits such information has the capacity to receive the information electronically. And the exclusion is an EP who does not collect any reportable syndromic information on their patients during the EHR reporting period or does not submit such information to any public health agency that has the capacity to receive the information electronically. So this is our 10 menu objectives. So what do you need to prepare? For those who have not attested already, who have not started already, what you want to make sure is all your setup is complete. So you want to make sure that your OID, is signed up for your health vault, that you have e-prescribe, you have your alerts set up, you have an exam summary letter, you have your outside physicians documented, and that you have education resources. And we also do have, which I'm going to go over in just a moment, your meaningful use wizard. So as you saw through the examination, those highlighted areas in that seafoam green color, that will help you out so much for each patient that you see to remind you, have you done everything that you need to for meaningful use? It really is the best tool that you can use to ensure that you are satisfying everything that you need to. Now, towards the end of the reporting period, you want to remember that well, the electronic exchange of health information no longer applies, but the most important thing is your security risk analysis. And then if you were to do the menu objective patient list, to do that, and also remember if you did your alerts. So you just want to make sure, in case of an audit, do you have all the information that they're looking for? If someone came in today in your office and say, okay, show me everything that you did, you have that proof. We also do have an attestation calculator. Actually, CMS.gov has an attestation calculator. You'll be able to find this calculator in our website, so that will help you out. Before I finish up, I do want to show you on our website. It is the best tool also that you can use as far as information. If you go to My Vision Express, and if you go to our Support Central, you do have to sign up for it, or you do have to register for it. It's very easy. But we do have a meaningful use section. So I'm just going to go back to my Support Central here to kind of start over. So I'm going to go into Support Central, and I'm going to sign in, if I'm not already signed in. I am. Okay, so we have a meaningful use section here. So when you click on it, it's going to show you exactly what is meaningful use. It gives you these wonderful links. So you have a registration user guide and a registration and attestation system section here. And then I mentioned an OID and Health Vault before. So for those who don't know what an OID is, it's an International Organization for Standardization Identifier. This is actually what you need to sign up for before you can sign up for Health Vault. It will allow you to generate this continuity of care document, the CCD. So we do have a link here to show you for where you need to sign up, as well as how to request the OID. Then you have another link here for registering for Health Vault. So this will allow you to see how to register for Health Vault within My Vision Express and all the steps that you need to take. We do also have a checklist, and we do have tutorial videos here for you guys in case you do want to kind of review and freshen up on the objectives. Going into My Vision Express, I did mention 2 reports and the wizard. So as I mentioned before, there's sections that are highlighted in this seafoam green color to remind you that it is related to meaningful use. We do also have a checklist for each exam that you do. So this green box on the top here will allow you to view all the objectives and if you've achieved them or not. So you can even see here, I have not achieved my medication list or my allergy list or my demographics. So while you're still in the exam, you still have a chance to look and see how you're doing and then correct it. That way, once again, you can ensure that you are going to attest successfully. Now, as far as the main report, if you want to look at that reporting period and see how you're doing, you're going to go to File Setup. You're going to go to File Reports and Meaningful Use. You do have your core objectives that are already checked off. You have your menu objectives. So I'm going to go ahead and pick 5. Then your clinical quality measures, I'll just go ahead and pick 3. Then you have your date range here, and then your physician. For those who have multiple locations, you can check off current location only to see how you're doing in that specific location. And then I'll just run the report. And then it'll tell you within that reporting period how you've been doing. So you have an attestation section here. This will be for your yes or no questions. So for drug interaction checks, you would just check this off. It's going to ask you, have you enabled this functionality? You'll say yes, and then it checks it off for you. Your exclude section here, for those objectives that exclusions apply. So for number 1, CPOE, if you did write less than 100 prescriptions in that reporting period, you can go ahead and check off exclude. and then that way you'll know that this is an exclusion. And then of course you can always print this report out for when you do a test. So I'm going to go ahead and wrap up, and then I guess I'll go ahead and answer some questions. I do thank you so much for attending. If you do want more information, or if you want to schedule a training session, you can contact me. My phone number is 1-877-882-7456. My extension is 713. Or if you even want to email me, Denise@myvisionexpress.com.